In this scenario, we have an expecting mother, Carla, at Dr. Melanin's clinic for her routine prenatal visit. She is on her second trimester, gravita 1, term 0, preterm 0, abortion or miscarriage 0, living children 0.
Hello, good morning, Miss Carla. How are you doing today?
I'm good, thank you.
Okay, that's great. So I'm Charlene, and this with me is Chezza, and we'll be your nurses for today. Okay?
Okay, so to start off with your visit today, we're just gonna have to take your vital signs. So that's gonna be including your blood pressure, your pulse rate, your heart rate, and your respirations. So first, I'm just gonna. Can you spell to me your last name just for validation, okay?
Sure. Ortiz, O-R-T-I-Z.
Okay, perfect. So also, speaking of those vital signs, we're just gonna take your weight too and your fundal height so that we're gonna know if you're on the right track of your pregnancy, okay?
Oh, sure, no problem. Go ahead and use that.
Okay. Awesome. Thank you.
So the nurses proceeded in doing their routine assessments, her vital signs, her weight, and her fundal height.
Okay, so based on your records here, your vital signs are within your normal ranges from your baseline, so which is a good one. And also your weight and your fundal height are where it is expected to be, so which means you're in the right track of your pregnancy already.
Okay, and we're just wondering if you have any other concerns.
Regarding that, I've noticed that I'm having severe acne the past few weeks, and I'm having brown spots underneath my eyes.
Yeah.
And I also have like the spider red spots on my neck, and my stretch marks are, I think, it's getting worse.
Okay.
So, do you mind if we're just gonna take a look at it?
Oh, no. Go ahead.
Okay.
So the nurses proceeded with a skin assessment with the patient's consent.
Well, I actually don't know, but I've asked my mom about it, and she told me that she has it when she was pregnant with me. And she said it's normal.
Okay, so was it just the same as hers, or was it worse, or anything?
Well, I let her see it, and she told me it was more severe than what she had before.
Okay, so actually what you have, the dark spots that you have is what you call mask of pregnancy, and that are usually called melasma. So melasmas are dark splotchy spots on your face. Usually they're in your forehead or on your cheeks. And pregnant women usually have this because of the elevated hormone levels during pregnancy.
So you mean these dark spots are called melasma? And is it because of the estrogen or progesterone?
More on estrogen. Okay.
Oh,
Yeah.
I see.
And because of those elevated hormone levels, it causing to increase your pigmentation, and that is what is happening into your face right now. Okay, and so to avoid those or to control it from worsening, you can either put a good sunscreen every time you're planning to go outside, or maybe you can wear your favorite ball cap to protect your face. Okay, and because during pregnancy your skin is a little more sensitive, so we have to lessen your sun exposure. Okay.
Okay. So about your stretch marks, like the one that you have showed me earlier. So it is usually caused by like tiny tears of the tissue just underneath your skin, because it causing your the baby in your tummy, the rapidly growing baby in your tummy. So that's it. And also it could be caused by an increase in weight gain. So watch out for what you eat. Okay, like cut off those caloric intakes. So yeah, and earlier your weight was within what it is expected to be, which is good. And some of the management about those stretch marks, because it's itchy, right?
Yeah, it's really itchy.
So just apply moisturizer on it, the one that you're used to using moisturizer. Okay, so just to prevent those dryness after like you're itching or something. Okay. Awesome.
Okay, and so you told me about spider-like red spots on
Yeah,
your
actually,
leg, right?
yeah.
Yeah. Okay, so those are what you call androma or spider nevi in some cases, and so those are reddish blood vessels that branch outwards. Okay, so that's why it looks spider-like. Okay, and it is caused usually by increased blood circulation. Okay, and so to prevent those, you can actually avoid crossing your legs.
Oh.
Yeah.
Well,
Well, yeah, that should be fine. And so, well, fortunately, they'll usually disappear shortly after delivery or something.
so it's not really alarming.
Yeah. No.
Yeah. So and yeah, lastly about those acne that you're really concerned of.
Yes.
Well, most of pregnant women are devastated with acne during pregnancy. So, it is mostly and usually caused of your increasing hormones and also like eating those junk foods and everything. So just get rid of those toxins. Yeah, and eat like don't forget to eat your green leafy vegetables. They will help you with that one, just to keep your skin tone and everything. Most especially the ones that she said, the vitamin C supplement, which is a really great help. Yeah, and also like prevention and like management of the acne. Wash your face with just not with a harsh soap, just to not irritate your skin. Also apply moisturizer, and please don't prick those pimples because it will just get worse.
Yeah.
And it will
It's
spread
really
infection.
painful.
Yeah. So yeah, and if you're really concerned with your acne after pregnancy, like if it will stay there, maybe our doctor
Melanie.
Yeah.
Dr. Melanie.
will just prescribe you like the ones that are accepted to pregnant women to use on.
Okay.
Yeah.
Well, thank you, ladies. Thank you.
Yeah, thank you too.
So Nurse Chezza and Nurse Cha went to Dr. Melanin to give the gathered information and concerns from Carla.
Hi, Carla. How's everything going?
I'm good. How are you?
Good, thank you.
That's good.
Congratulations for your baby girl.
Thank you. I'm so excited about it.
Yes. So I was just looking at your laboratory work from our last prenatal visit, and as far as everything's going, it's all good.
Oh, that's
Yes.
good to hear.
Yes, and your vital signs are good, so that's very good. Okay, so the nurses told me about your concerns about your skin.
Yeah, I actually, they already explained it to me very well, and I really understand about it, about my dark spots underneath my eye. They call it's melasma.
Yes,
And the red spots on my neck are angioma.
Yeah.
Yeah, and then I have some acne and stretch marks, which is worsening. So they told me some things to like control the worsening. About my melasma, they told me to use some sunscreen if I'm planning to go outside, and use some protective like ball caps, and just minimize the sun exposure.
Yes.
And for my angioma, the spider-like red spots on my neck, they told me like to take lots of vitamin C. And for my stretch marks, they told me to put some moisturizer if it gets itchy, and just avoid scratching it. And they also told me not to cross my legs too often, because I often cross my legs, and they told me that it's bad for my angioma, because they might develop onto that too. And for my eating diet, they told me to avoid any junk foods or bad foods, oily foods, and just to take some green leafy foods. And for my acne, they told me just to wash it with smooth soap, not the ones that are harsh,
Yes.
and use some coconut oil to it. So yeah.
Yeah, so I think that you have a lot of knowledge regarding your
Yeah,
condition. So regarding your concern with cross-legging, so we advise you not to do that. Now, it's not just for your angiomas, but also because we want to promote venous return. We don't want edema on your legs.
Okay.
Of course, it's bound to happen, but we want to minimize that.
Okay.
Yes. And you can also elevate your legs and do some exercises if you want to. Okay. Now for the treatments for your skin conditions, what we can address right now is your acne. So what I'm going to do is I'm going to refer you to other dermatologists, and you need a prescription for your anti-acne creams because there are medications that are contraindicated for pregnant women, and we don't want to use that. And then, as far as we're concerned, since you're still in your second trimester, your skin conditions will either be stabilized or worsen. Yeah, that's how pregnancy works. So, what we're going to do is that I advise you to be patient because after giving birth to your child, it will still take a while for your hormone balance to be back from when you were not pregnant yet. So after that, I can assure you that your red spots and brown spots, those angiomas and melasmas, they will disappear.
After delivery?
Not really. A few weeks after delivery. Okay. Yes. So you can go back to me, and if these things don't
settle down.
Yes. If they don't get removed or something, you can go talk to me, of course, and then I will and of course your stretch marks. Since your family history says that your mom has stretch marks, most probably since it's pathogenetics, the composition of your skin, most probably it will stay there. But what we're going to do is that I am going to talk to a cosmetic surgeon if you're really concerned about it. Yes. Okay, so what the cosmetic surgeon is going to do is that we can do the laser surgery. So that's popular these days. So you can do that. Or there's also a cellulase therapy. So those are the things that we can do for now. So just wait, and then I will refer you later on to a cosmetic surgeon.
Okay, thank you.
Yes. So do you still have any other questions?
No, actually, it's all the things that you said really helped me to understand that all these things that's happening to my skin are normal.
Yes.
And it's really helpful for me. Thank you.
Okay. Thank you.
So
it was nice talking to you.
thank you, Dr. Melanie.
Yes.
Thank you for
And see you for your next prenatal.
Yeah, see you.
Take care.
Bye.
Bye.